We also have other technology, which is a three-dimensional cone beam X-ray machine, which three-dimensionally captures everything from the airway space, and it's actually colored in to where we know where the real constriction is in the airway space. That gives me a lot of benefits knowing if they're going to be a candidate for oral appliance therapy. If the constriction is very low in the neck, then they may not be the kind of candidate we're looking for to be able to help. If it's higher up, then it is another tool that can help me decide whether I can meet the expectations of the patient. So it works there as well as for our TMJ patients that have a lot of jaw joint problems. We're able to capture the joints, be able to know exactly where they are, if they're dislocated, where we need to place the joint to get it back into place to relieve the pain that they're having. So a lot of nice benefits that helps give more tools for me to help make a better diagnosis, make it easier on the patient, and it's a win-win for the patient as well as for us, and also the outcome.